Good morning and happy Saturday to all Saint Lucians who have joined us for this live broadcast at home and abroad. We want to apologize for our slightly late start. Welcome back to the Information Command Center, keeping you updated on Saint Lucia's COVID-19 response. I am Nicole MacDonald. We start the weekly recap today, this Saturday, with a special update with Prime Minister Honorable Chastanet. Also joining us soon will be the Minister for Tourism. And in studio, we have the Chief Medical Officer, Dr. Sharon Belmar-George, and the Chief Environmental Officer, Mr. Parker Ragnanan. Good morning, everyone. Good morning. Many Saint Lucians would have followed the announcement yesterday, Friday, May 15th, as the government of Saint Lucia revealed the framework for the reopening of Saint Lucia Society, which outlines specifically the types of businesses that may operate and the level of activity which would be permitted. We learned that as of Monday, May 18, 2020, more sectors and businesses will be allowed to open as our country learns and adjusts to living with COVID-19. Of course, under national COVID-19 protocols established by the Ministry of Health. The presentation yesterday was very detailed, and the information shared is readily available on the GIS online pages. The information on the phases and relevant details are also available on covid19response.lc. We invite Saint Lucians to turn to these information outlets for factual information and regular updates. The latest Emergency Powers COVID-19 Statutory Instrument number 74 has also been published with the updated information, which will take effect on Monday, May 18th. Among the decisions announced yesterday was that the zones would be removed as of Monday and the curfew time would be adjusted to now start from 9 p.m. to 5 a.m. This morning, we will go through some of these announcements made yesterday and really focus on the rationale behind the latest steps we are taking as a country to reopen the local economy. We would not be where we are today if it were not for the team at the Ministry of Health, thrust into the limelight to deal with COVID-19, yet still having to address other matters within the health sector. The Minister of Health, Honorable Mary Isaac, the CMO, the contact tracing team, and all the staff at the Ministry of Health who keep reminding us always that it's not over yet, the battle continues. Dr. Sharon Belmar-George will begin today with a presentation to update us on the health perspective and the new things we will be starting from Monday. Dr. Belmar?
Thank you. Good morning, Honorable Prime Minister. Good morning, Ms. MacDonald. Good morning to the general public. This morning, I will give a short review on the data analysis for COVID-19 for St. Lucia so far, so that the public can take a look of where we came from and at what point of the epidemic that we are now in St. Lucia. As is customary, I will start on a global scale to give an idea of the numbers out there. Globally, we've noted a total of 4,338,658 cases with 297,119 deaths, and this is as of May 15th from the WHO COVID-19 situation report. For the region of the Americas, we've noted a total of 1,864,468 cases with 111,934 deaths. Globally as well, just to show you some of the other countries, the total number of confirmed cases that have been seen, and also the total number of deaths. Our next slide gives a comparative view for Barbados and the English-speaking Caribbean per 100,000 giving an indication of the incidence of COVID-19. If you note, the incidence for Saint Lucia is at 9.8. And just to give you in relation to the other islands, you could see where we stand in terms of our levels of COVID-19. St. Vincent is there at 15.32, Grenada 18.66, Anguilla at 20, Dominica and Barbados at 28.88, just to give an idea of where we stand with our numbers per population number. Also our COVID-19 statistics for the English-speaking Caribbean, this slide gives an idea of where we stand with testing numbers for the region. And the information there, we left it at May 8th because it shows where all of the other countries were at the same time. And on May 8th, we were at 620 tests. And if you notice, if you look through the different islands, you'll see how the numbers compare at this time, where all countries are trying to increase their testing capacity. St. Lucia was at 620, Grenada 309, Dominica 416, Barbados has the highest number at 2,788. Anguilla was at 18, St. Vincent 116. Our numbers have since increased. I think the last number was 700 and something. I don't remember the exact number. Our next slide gives an idea of the curve for all of the CARPHA member states, the lab confirmed new cases in the CARPHA area, and it shows some level of leveling off for our CARPHA member states when you put all of our cases together. According to Dr. Clive Landis, projections done by UE, the COVID-19 task force, indicated that the countries would be faced with between 200 and 900 patients seeking care. As of May 12 in the region, we saw a total of 748 confirmed cases with 43 deaths. I'm going to give another quote from him. The coronavirus has been contained in the English-speaking Caribbean and Haiti. The bottom line for the whole Caribbean is that the Caribbean has avoided the kind of outbreak, the kind of epidemic that we've seen in many European countries and North America. The regional response for COVID-19 in the next slide, you will notice a lot of the measures that were taken, most of them were taken within the region. The closing of schools, the travel restrictions, the social distancing, the state of emergency, and a lot of this has to do with the level of coordination that occurs through the Caribbean Public Health Agency, the Pan American Health Agency. A lot of the responses within the region was done through collaboration and a lot of discussion on a regional basis, knowing the importance of us taking care of our nation as whatever we do in one island has an effect on the other islands. So we cannot manage COVID-19 alone, so a lot of the measures were very important. On a local update, the total number of tests done to date, 786. We've had a total of 18 cases. All 18 have recovered. We've had no complicated cases and no deaths. At this stage, we have 287 in quarantine, and this is due to the number that we received from the cruise vessel. We have 63 persons isolated, and to date, we have managed over 900 persons in both quarantine and isolation through our system. When we look at the persons who've been positive with COVID-19 in Saint Lucia, 67% of them were female and 33% were male. The age group which was most affected was the age between 50 and 54, followed by the age range 45 to 49. Based on the travel history, 44% had a travel history and 56% did not have a travel history that we were aware of. This is a map of Saint Lucia to give an idea of the concentration of our cases so far to date. You'll note by the red dots, the bigger dots indicate more cases, the smaller dots, less cases. You notice in the north of the island, we've had cases down through Goodlands, Ticolo, Marigot, but the majority of our cases you'll see are distributed on the eastern coast of Saint Lucia. And I have to indicate that all cases have recovered fully, both clinically and through confirmed laboratory diagnosed testing. So all of our cases are safe to be reintegrated into our communities with their families. This gives an idea of our epi curve, which, as you've seen for most countries, the curve that you note when you get your increase in cases, you'll notice where it peaked off. And if you notice for the last few months of May, it's been blank. There's been no cases because all of my reports for the last few weeks, although we have been testing, our last set of testing was a batch of 59, which we received yesterday. All of them were negative. So this is why you notice for the last few months, it's all in zero. And this graph is to give an indication of the change in the testing strategy from the beginning of the outbreak to the end. When we started getting cases with COVID, we stuck with the case definition where someone was tested if they had a travel history and developed signs and symptoms for COVID-19. But as we got our first in-country case, our strategy changed to testing everyone who developed signs and symptoms. And through that strategy, we did exhaustive testing through our respiratory clinics and also through community groups. And you'll notice that increase in testing is due to the increased numbers of persons who were tested based on the change in the testing strategy. This gives an idea of the various phases of the epidemic from the start to the end. And this slide explains the public health strategy in the management of COVID-19. It gives you an idea of how we managed from stage 1 before we actually got cases. As we moved into stage 2, during stage 1, our main focus was protecting our borders with the various travel restrictions that were instituted. And it was a major preparation phase for the possibility of cases coming in. So during that phase, there was extensive healthcare preparation, our training of our healthcare workers, preparing our facilities, ensuring our plan was complete and comprehensive, ensuring we had enough personal protective equipment on island, and a lot of consultation, aggressive health education. As we went into stage 2, which was mainly mitigation, where we saw increases in cases, our main aim was to slow down the increase in cases and to flatten the curve. So apart from the increase in our public education, we developed the capacity to test locally. We expanded our quarantine and isolation with the use of the hotels, intensified contact tracing. Our centers were open. We canceled mass gatherings and implemented physical distancing measures and ensured sufficient supplies of personal protective equipment and to sustain during the weeks to come. Stage 3 speaks about established community spread. This community spread was limited to certain zones in Saint Lucia, and our main aim was to ensure we reduce the clusters or the spread of the disease. Although we didn't go fully into this phase, a lot of the measures were implemented in a very proactive way to reduce any impact or spread. So the unified command, which was set up out of the office of the Prime Minister, the 24-hour shutdown, which was set up, the curfew measures, which remain in effect, although for less hours from Monday, and a lot of collaboration in the implementation of social and economic practices. As we move into stage 4, which is a recovery phase, our main aim is to keep the numbers low at this point. There are 3 possibilities moving from where we are now, we could completely break the transmission with 0 cases moving on. This is very unlikely given that we are a susceptible nation and a vaccine has not been available as yet to ensure protection. So we are still susceptible. COVID-19 is still out there. So we have to ensure that with the strengthening of the health system and the physical distancing measures that are implemented, that we live safely in a COVID-19 environment. So we continue with the aggressive testing and monitoring of the border, our universal temperature monitoring, ensuring that all of the protocols are adhered to as we slowly reopen the economy. The health education has to continue as well, and all of the guidelines which has been set. What we anticipate for Saint Lucia is small waves where we may get a few cases, small increases with decreases with low-level transmission at this stage. So as a region, as Dr. Clive Landis indicated again, the region, we have to learn to live with this threat. It is not realistic for us to remain on 24-hour shutdown. And for us to be able to do this would require for the public to work very closely with the Ministry of Health, also the private sector, the public sector. Together we have to ensure that all of the protocols which will be discussed by our Chief Environmental Health Officer are adhered to in a very responsible manner.
Thank you very much, CMO, for that extensive presentation. We now turn to Prime Minister Honorable Alan Chastanet. There's been some major decisions taken by our country, and now we're talking about reopening. Can you take us through the rationale behind it and some of the steps that got us here, and what will it look like for our country moving forward?
Thank you very much, Nicole, and thank you very much to the CMO. Today really is a milestone. It's a day that we had envisioned when we started on this trek really in late February. I don't know that any of us would have expected that we would have had to go through what we've had to go through. But I think it's really a credit to the Minister of Health and to the PS of Health and their staff, as well as the CMO and their office, who jumped on board very early on this crisis. And I have to say that have given excellent advice to Cabinet. And I'm very grateful for the support that we had in Cabinet to adhere to these very uncomfortable protocols and having to make some incredibly difficult decisions along the way. At all times, the advice has been given and decisions have been made on the basis of science. And sadly, there had to be some judgment being made because we all did not have the details as to COVID. As you remember, COVID broke out initially in China, and there was mixed information coming out of China as to the severity of COVID. And it was not until COVID actually hit Italy that I believe that the Western world started taking this much more seriously. And certainly the idea of a curve and the need to flatten the curve became apparent to everyone. So the fact is, in Italy, they did not do a very good job of flattening the curve, nor has New York City. And as a result of it, many persons who probably should not have died ended up dying. And that flattening of the curve required several measures, and I'm very grateful that we got good advice from the CMO, and that advice was adhered to. And I think that the other persons that we must recognize are the public of Saint Lucia, because certainly without their support and participation and cooperation, we could not be where we are today. So I think that Saint Lucians need to give themselves a pat on their back. The fact that when you look at the number of persons that have been affected on a per 100,000 basis, Saint Lucia is by far the least. And so the job number one of protecting St. Lucians' lives has been achieved. One of the other fallouts of COVID has been the unpredictability of COVID. And as a result of that, it's been difficult to give persons advance information as to what the next steps are going to be. And I think that I've often quoted the governor of California, who said that this is not a light switch that you either put on or off, but it more resembles a dimmer switch, and one in which you're constantly trying to find that ideal level of light, depending on the time of day, as to how much light you're going to need. So the Saint Lucia team has shown the ability to maneuver that dimmer extremely well. And while it's a physical action, there are a lot of things that take place. And the number one being people's behavior and reaction. So having to spontaneously make a decision to shut the country down for a 24-hour curfew and literally put everyone into isolation, there was a lot of fear as to whether the public of St. Lucia would have responded immediately and would have adhered to that call. But we've seen that they did it. And despite, and we all know, a tremendous amount of pain on a lot of persons' part, persons who literally found themselves having their household shut down, isolated from loved ones, and more importantly, not necessarily having enough food in the house to last even 2 days. There's a tremendous amount of courage and discipline that would have been required for persons to have done that. And I think that St. Lucians should never forget that when it came their time to be tested, that we passed that test in flying colors. And so a lot of persons who are accustomed to criticizing and demeaning their country and their citizens, I'm sorry to say, but the proof suggests otherwise. We are a resilient persons. We are much more disciplined than persons want to give us credit for. And I believe that the vast majority, and I do mean the vast majority of persons, are willing to put their country before themselves. And that's been proven through this test. So what's the milestone today? The milestone today is that the CMO and the team, the command center, have now laid out a pathway for the next 6 months as to what persons can expect. And I think that as the CMO has indicated, that does it mean that we're not going to get any cases between now and the next 6 months? That's not what we're saying. What we're saying is that the protocols that we've put in place, the team that we have, that the level of confidence now that we have in both of those things tells us that we can handle an outbreak. We've seen, and I've often said it, and I want to say it again, the contact tracing team that we have are heroes. Because sometimes when persons have a job to do where they don't even know who they're going to be in contact with, whether in fact that person has COVID or not, it could be understood that persons would not do their job as diligently and as thorough as would have needed. But time has shown, and the evidence has shown, that our contact tracing team are among the best in the world in terms of what they have been able to achieve so far. So we have confidence in the team that we have. We have confidence in the protocols that we've put in place, that if in fact there is going to be an outbreak, that we could manage that outbreak. We're also confident because we have moved into OKEU, and we're now physically preparing Victoria Hospital to be a full respiratory hospital. We've secured resources from the World Bank, and they have amended all kinds of protocols to allow us to implement that project in record time. And we're talking about, if I'm not mistaken, 91 beds and 70 isolated rooms. Despite the difficulty, and I have to say to you, the difficulty in getting and procuring PPE equipment, with the assistance of Taiwan and the assistance of many other countries around the world, we have been able to acquire our fair share of PPE, including respirators. I understand that we have 14 of them either have arrived or are about to arrive on island. So we do have a proper facility to deal with an outbreak. We've certainly increased our capacity 1,000-fold by what we have done, because certainly if we'd had any significant outbreak prior to that, we would have had to have handled it, but I'm not so sure that we would have handled it very well. Certainly what happened in Italy or in New York City, if on a relative basis that had happened here, it would have been an absolute disaster. So I want to say that today's milestone is that we have a better understanding of what to expect. We have confidence in the team and the protocols that we have, and that now has allowed us to establish a much longer timeline to transition. And as I said at the beginning of this process, that this really is broken out into two components. One is the health component from COVID, and the second one that all of us can anticipate is the economic fallout. The economic fallout, which I will deal with, we couldn't get to that part of it until we dealt with COVID. So I'm very proud to say that Saint Lucia today domestically is ready to coexist with COVID, and I think that persons should feel comfortable to go out to do their work, but certainly to be reminded at all times to practice the social distancing and the protocols that we've put in place. The hygiene, wearing a face mask, staying relatively far away from each other, 6 feet apart and not 6 feet under. These are all important things that we must continue in our day-to-day lives. So we've indicated from very early that we could not and cannot address the economic situation until we resolve COVID. Because you can't open up your economy, you can't get businesses going if in fact persons are fearful of losing their lives, and certainly that we were under a constant threat of having to shut down a country in its entirety and return back to a 24-hour curfew. You can't have that hanging over your head if you're going to be opening up businesses. So today, we can announce that Saint Lucia is ready to open up its businesses. I believe a very clear timeline has been established by the team. More importantly, that while we're giving persons permission to open up, they still have to apply to make sure that they understand what those protocols are. So just because today we're saying a particular type of business can open up, doesn't mean it on their own that tomorrow they can open up. They have to go to the relevant ministry and make sure they put in the protocols which are approved by the Ministry of Health, as well as the police officers. Because we do not have the manpower to make sure that we have police officers at every business to make sure that they're doing what they're supposed to be doing. But like your VAT certificate, you have to display your approval letter from the ministry that clearly outlines what your protocols are, so that either a health officer, Mr. Ramjian, or a police officer can go in and determine whether in fact you're adhering to them. And if you're not, that you will be shut down. And I think that's an important element that persons must know, that this is not about just allowing you to do and have faith in that you're doing. We are going to be following up on a regular basis to make sure that you are adhering to the protocols that you have submitted and you've approved to do. The next part of those protocols is our international borders, which is a critical component to our economic recovery. The international borders is substantially more complicated because it requires the participation and the support of other countries. And as I indicated yesterday, we expect by June 4th that Saint Lucia will be open, its international borders will be open. Now again, just like what I just said with businesses, just because we're saying a business is open doesn't mean that the following day that business can open. So similarly, international hotels and whichever attractions we're permitting to open must submit their protocols and get the approvals from the Ministry of Tourism, who will work with Ministry of Health and the police to accept those protocols. In the case of the international border, there's also an expectation that when guests come, that there are things that they have to also go through. Sadly, as we speak today, not many countries are ready to open up their borders. So just because we have opened up our borders, I'm not expecting there to be a rush of people to come in. So England, as an example, still requires persons, if they're traveling outside of England and they return to England, to go into quarantine. So does Canada. In fact, some countries still have travel warnings and advising their own citizens not to travel overseas. But I think it's important that we let the world know that we are ready. I'm very proud of the work that Saint Lucia has initiated, and more importantly, that we're working with our brothers and sisters at the OECS level and now at the CARICOM level to establish a common policy towards opening up our international borders. It's an important milestone to have achieved because it makes it much easier for the airlines to coming in, but more importantly, if we have 14 countries in the Caribbean that have a common position, then it makes it easier for us to make sure that those standards are adhered to. If Saint Lucia was attempting to do something by itself and another Caribbean island was doing something less stringently, then the airline and the tour operators and everyone else would come back to Saint Lucia and say, well, this is what's taking place in the other island. And therefore this competition between ourselves, which is natural, would coexist. So I'm very grateful to the chairperson of CARICOM and all the other prime ministers of CARICOM to agree that we share what we're doing and that we come up with a common policy. So we are working towards that initiative. I was saying to the CMO while we were waiting to come on air this morning that my office now is going to spend less time with her and her team. I think that they're more than capable with the Minister of Health to continue down the road that they have, and that we have much more clarity as to how we're moving forward, and that the efforts of my office now are going to be very much focused on the economy. And I have articulated since the beginning of April, and even before, but certainly in the beginning of April, that I am very concerned about the government's ability to continue to fund all of our operations. So we do know that until the tourism border opens up, that the most that we probably can generate on a monthly basis is $60 million. And that with the continuing pressures on our bonds and treasury bills, and for natural reasons, I don't think that anyone is pulling out of our market because they don't have confidence in Saint Lucia, quite the contrary. But certainly companies and individuals need the liquidity themselves because of what's been taking place with COVID. So there is a shortfall of about $30 million a month. And I remember many years ago attending a finance meeting, and the Minister of Finance from Nigeria, of all countries, when everyone was complaining and lamenting about the structural adjustment programs that had started in the mid-'80s. And he said that Einstein said that matter is not created nor destroyed. And he said money is the same thing. that money doesn't just disappear, it's just that you have winners and you have losers. And right now, we have a losing proposition. The cost that we have and the revenue that we're generating, even with a downsized budget, is still producing a $30 million gap. And we're going to have to figure out how to solve that problem. And this is why we've attempted for the last 2 months to work with our civil servants as stakeholders. Because if we continue going down the path of ignoring that financial deficit, they will get to the point where we cannot pay our debt, and also we would not be able to pay salaries, because where's the money going to come from? And so we have to reduce that gap, and there's no way that you could ignore that our wage bill is almost 40 to 45% of our total cost. And then your debt is another 20%. So you're talking about 65% of our overall cost of operations consist of our wage bill and our debt. So those are two things and two areas that we have to concentrate on. I was very clear yesterday that while we have successfully gone out and raised over $500 million to finance the budget, but that financing was on the basis that we would generate $920 million in revenue. We're on track for $720 million, $200 million gap. And so that is the additional money that we need to go and raise. And we cannot borrow the money to pay for that $200 million. That $200 million has to come out of cost savings, because it would just be impossible to repay that money, and it certainly would make a bad fiscal decision to do that. And that is what has got Saint Lucia and also many other countries in the past in problem. If you're borrowing money to pay for salaries, or if you're borrowing money to pay for existing debt, trouble. It can borrow money for capital projects that are helping to improve the capacity of the country and can generate growth, so that that growth now can help you repay for the debt. So my office will be very much focused on that. We've had our third meeting with the Economic Recovery Council. The Recovery Council now has been divided, I think, into 4 or 5 separate groups. The expectation is that we would get at least a draft report by the end of the month. And that is to try to figure out collectively what are the areas on our economy we need to work on to help with the recovery. And I would expect that that report will generate 2 components. One is critical projects to continue to cause the economy to grow and to tackle long-standing deficiencies in our own government. And so right now is the time to use this crisis to make this significant transition, particularly to an e-government platform. The other component that my office is going to remain very much focused on with the Minister of Equity is our social stabilization program. So my understanding is that NIC has received over 18,000 applications and are starting that process. We have been able to, or in the process of transferring the funds for the informal sector. The feeding program is going on in earnest, and the feeding program will have 2 components. One will be the hot meals or cooked meals for the more vulnerable in our society, the elderly and the handicapped, as well as some of the more infirmed persons in our society. We will also now be preparing, I call them local care baskets. So it's a box with ground provisions and products, fresh produce that comes from our St. Lucian farmers, along with either some fish, some chicken, and some eggs, our poultry industry. So the intention is twofold. One, to help those persons that are most affected so that they have some food on the table. And secondly, one is to provide an economic package for our local farmers, our fishermen, our egg producers, and our fresh farmer producers, because it's going to be impossible to replace the demand that we had when we had tourism operating. So we have seen in the economic recovery side of it, good potentials with the call centers, and I'm working with the CMO's office to make sure that we have the necessary protocols in place. The other one that we have to start now working on in earnest is the hurricane season. So you will start noticing that desilting and clearing of drains has already begun. We want to be even over-prepared from years past. We are working with the Ministry of Economic Development, World Bank, and CDB to see if we can repurpose some of the loans to assist in fixing up schools, as well as fixing up some of the shelters. There's a critical element that's going to be needed, and I know the CMO is aware of this, that given the social distancing, that the number of persons that could have normally been in a shelter is going to be reduced significantly. So it means we're going to need even more shelters than we did before. And we're also going to have a stockpile of water and non-perishable items to get everyone ready for the upcoming hurricane season. And even with emergency service persons going out, they're also going to have the new protocols in place. And we need to sit down and have a meeting with NEMO to do that. I am going to take the events company and literally assign them to NEMO. So why would we do that? Because the events company are very good at working out logistics. And so that we're going to have a team that's really now going to help take NEMO to a completely different level, I think, in my mind, in preparing Saint Lucia and St. Lucians for the upcoming hurricane season. So the Ministry of Infrastructure, Ministry of Health, the Emergency Services, along with NEMO, are really going to, over the next couple of weeks, spend a tremendous amount of time giving more thought to our hurricane recovery and disaster challenges, simply because of what is taking place with COVID at this point. So even persons who are in the southern part of the island who may need emergency help, and then we recognize that they have symptoms with COVID, would have to be transferred to the respiratory center. And all of those protocols have to be worked out so that we're not putting any person in harm's way. So we have still a very long road to go before we're fully recovered from COVID. But I want to congratulate the Minister of Health and her team, the CMO, for all of the work that you all have done and putting us in a position today where we now can start focusing on these other aspects. There are many countries, sadly, that have not reached this milestone, and we should be very proud of ourselves. And lastly is to really say to the public of St. Lucia that we could not have done this without you. I want to thank you so much for the amount of support you've given us. My colleague minister obviously has been detained, but he has been a pillar of strength, and that is Minister Dominique Fede. His regular morning meetings, so he's brought in some of his hotel experience of where managers of hotels meet every single morning, and I think that it's really a tribute to him that he's there every single morning working through whatever problems arise within 24 hours, and everyone would be surprised to see how many things can go wrong in 24 hours. And therefore, I want to thank him for the incredible effort that he and his ministry, Ms. Vite, his permanent secretary, and their team. There's never a time that we've come to a meeting or we've needed their assistance and they have not been there. So certainly the quarantine hotels, the feeding program, the logistics behind everything that we're doing, he and his team have just been a pillar of strength. So I want to thank them publicly for all that they've done. So again, thank you very much, and congratulations to all St. Lucians for us achieving this incredible milestone.
Thank you very much, Prime Minister Chastanet. One of the things you said was that your office will be shifting a bit to now focusing on the economy. Just to let St. Lucians know, at the Information Command Center. We will also be having more panel discussions, more people coming on to discuss our economic recovery efforts. In fact, we should have the finance team joining us next weekend for a full panel to let St. Lucians know where our country is at and how COVID-19 has affected us. So thank you very much, Prime Minister. We want to go to the protocols. We have with us our Chief Environmental Health Officer. Just to let people know, he will be doing a full presentation after we finish here, going through all the protocols. But I just want Mr. Ragnanan to just speak to some of the things we learned yesterday. A lot of people are asking if they open, where do they go in order to submit their applications and for them to get their protocols. And of course, we learned yesterday that there will be a continuous 14-day review after each phase. So can you just go through with us briefly what will be the measures put in place?
Good morning, Honorable Prime Minister and Chief Medical Officer of St. Lucia. With regards to protocols, over the past months and weeks, we have been working assiduously in developing protocols to help different sectors in St. Lucia to put measures in place in order to respond to the challenges of COVID-19. As such, there are a number of protocols that have been developed or that are in train in terms of being developed. With regard to the specific question that you've asked, there are a number of agencies responsible for different sectors in St. Lucia. So what the protocols do is to allow the regulatory agency. So when we talk about beauty and wellness areas, we speak about the hardwares, the stores. These business places are regulated by the Ministry of Commerce, and therefore they would have to be in contact with the Ministry of Commerce in order to obtain the protocols that have been prepared and developed. These protocols would require that business places use the protocol as a guide to developing their own business response, because businesses are different in terms of their layout, in terms of the size, and the service that is offered. And therefore, the protocol is to be used as a guide to developing their own business plan in terms of meeting the health requirements that are outlined in the protocols. You have, for example, the construction sector, and the agency responsible for construction is the Ministry of Infrastructure. And so persons who endeavor to get involved in construction companies are advised to visit that ministry. Protocols are available and can be obtained. When we look at the schools, and I know that the reopening of school is also on a phase basis, whereas we're looking at possibly grade 6 and Form 5s returning for a very short time. There are protocols that have been developed and are now with the Ministry of Education, and so we encourage all school principals to contact the Ministry of Education to pick up these protocols. We are looking at the areas of faith-based organizations. And in St. Lucia, faith-based organization comes under ecclesiastical affairs, which is part of the mandate for the Ministry of Equity, Social Transformation, and Local Government. And therefore, we encourage church leaders who desire to open up the church. As you know, the churches had never been closed, but there was a limit to the number of the congregation, and that is no more than 10. For persons who desire to open up the church to larger numbers, we would invite you to contact the Ministry of Equity and Social Transformation to get the protocols, to prepare the plans as is necessary in order that you would get an approval letter from that ministry to go ahead with the different church activities. And we say church, but really it's for worship groups. So the persons involved in that area are asked to contact that ministry. We have also developed protocols in terms of offices and business places. And as we were told yesterday, we are expecting that a number of government offices and other offices to reopen very soon. There are protocols in place that you can use as a guide. Again, we want to emphasize that these protocols must be used as a guide for individual business places and companies and offices to prepare their own protocols to respond based on the needs that they have. So there is a protocol presently available for offices and business places. We have also developed protocols with the accommodation sector, and they are quite extensive. We have had all discussions at different levels, and we have prepared the final protocol for the accommodation sector. And we want to encourage hotels who intend to reopen in the very first phase to contact the Ministry of Tourism. The protocols will be made available to you. I believe it has been circulated already to the Saint Lucia Hotel and Tourism Association. But importantly, again, the Ministry of Tourism would require that hotels who intend to open to submit their own protocols and application requesting for the permission to open. With hotels, there are also consideration that has to be given to the legislative framework. And that is in St. Lucia, we have the Public Health Act, and there is a regulation under the Act that speaks to hotels, guest houses, and apartment houses, and that they must be licensed. And there are critical components of a hotel operation that requires licensing by the Public Health Board. And that would include the accommodation part of the hotel, the food preparation area, the kitchen and stores. It would include swimming pools, as well as the beauty and wellness sector of hotels for those who would provide that service. So the spas, the hairdressing, and even barbering facilities and massage parlors, all of these would have to be licensed by the Public Health Board. So these would be some of the prerequisites in terms of getting the certificate to reopen. We have also developed protocols for the taxi drivers and the taxi operators. And again, we would advise you to contact the Ministry of Tourism. The discussions have started with taxi operators, and by and large, there seems to be consensus that the protocols are adequate, and work has to commence in terms of getting some of the measures instituted by the taxi operators. There are also protocols that have been developed for the local processing of meat, and butchers, slaughtering facilities, and persons engaged in the local processing of meat are asked to contact the Environmental Health Department to get copies of the protocols and the measures that must be instituted, as well as for the retail of seafoods. These protocols have been established, and so you are encouraged to contact the Department of Environmental Health to deal with these. We have also prepared protocols working with St. Lucia and Seaports Authority to looking at opening up the borders, and in that instance we are looking at the airports. We have started work with the seaports. However, we have completed a protocol for the airports, and again, there have been discussions and continue to be discussions as to the implementation and the plan that SLASPA would have to put in place in terms of effecting some of the provisions of that protocol. As far as monitoring is concerned, we are going to be working collaboratively. At Environmental Health, we do not have all the resources required to be able to monitor every single facility at the same time, because we recognize that there are going to be a large number of business places that are going to be requesting to reopen in a very short period of time. However, we're going to be working with the different agencies. So the Ministry of Commerce, we've been partnering with them even before the additional businesses that are expected to open. We have been working with them in terms of the hardwares and doing assessments and sending reports on a daily basis to the Ministry of Commerce. We would continue to work with the Ministry of Tourism and to looking at the accommodation sector as well as the taxi sector. We are going to continue to work with the Saint Lucia and Seaports Authority and the other agencies in terms of instituting a monitoring system. As is also noteworthy, the police have been doing a tremendous job, and we're going to continue to work with the police in terms of monitoring of business places, ensuring that they follow certain protocols and certain guidelines. And we do not, at this point in time, wish that any business place would close, but we also want to say that if business places are not going to adhere to the measures, then the options would have to be that they close their doors until they can implement the measures. Because these are measures that are put in place, as you would hear later, to safeguard both employees and the customers and the patrons. These are very important protocols, and all business places, public and private, must pay attention to these protocols and ensure that they are in place to protect, like I said, staff and the people you do business with. Because what we do not want to happen is to let down our guards, and then we have a resurgence of COVID-19 and a greater outbreak. So we have to be mindful of this. So these are some of the measures that we are looking at instituting and working with several different sectors in trying to have a harmonized approach for monitoring, auditing, and ensuring that the protocols are implemented and adhered to.
Thank you very much, Mr. Ragnanan. As I mentioned, Mr. Ragnanan will be going into greater detail a little bit later into some of those protocols. If you could just address, before we get to the questions from the press, is there a system where Saint Lucians who notice that protocols are not being followed in various businesses can make contact with either the Ministry of Health or the police? Has there been anything set up for that?
This is work in progress. We are going to alert and we welcome, because this is one of the ways that you can actually monitor is by getting feedback from the public. So we'd welcome when observations are made. I know we have gotten complaints for certain sector, and I don't want to single out any person,
of course,
any individual one, but I know that our office have received information, for example, when you have vehicles that may have more than the number of passengers that they can have, and sometimes you have the customers on board are not wearing face masks. We've received reports on that, and we've had to respond to this thing. So we welcome complaints and observations from the public, and they can always contact us at the Department of Environmental Health at 468-3700. And we would try our best to following up on whatever complaints that we receive, because this is one of the means that is very, very important in terms of receiving information, but also having, if you want to say so, eyes and ears on the ground, that we may not necessarily have. So we think that is going to be very important for us to work with all sectors and the public as a whole, and to share that kind of information.
Thank you very much, Mr. Ragnanan. We have some questions that were submitted by the local media. I want to start with a question from Jade Brown, the news editor at NBC, who wanted to know, this might be for CMO, what will be the quarantine measures once visitors arrive in Saint Lucia? Will they be confined to the hotels?
Okay. As the public is aware, even before our borders were closed, we looked at the risk of the various countries, and we implemented restrictions. With the opening of the borders, there are a number of measures that we will put in place, knowing that we expect repatriation of nationals and also visitors who may come to utilize some of the accommodation sector that is there. Given that the level of risk in the international arena still exists for COVID-19, and as much as we have many levels of protection at every level, we have protocols to reduce this, we also ensure that whether it's a local or a national, that those measures are in place. When you review the protocols for the accommodation sector, because of the number of limitations, you can almost say that the visitors are in quarantine within the hotel. I don't want to say that, but it's practically that. The protocol allows for most of the activities, the majority of the activities, with probably an exception of a tour going down to Soufrière and back, but not coming off the tour. Most of the activities will be confined within the hotel, within the accommodation sector, the entertainment and all of the activities. So this means that the visitors would not be allowed to rent a car and go into the communities. We are reducing the transmission of visitors coming in as much as possible into the community and the rest of the public. So the first phase of tourism is tailored in such a way that the confinement remains on that property.
Okay, thank you, CMO. PM, did you want to address?
Yeah, I just want to again thank the CMO for that. I think that what is important to visualize is that really the first part is a pilot phase. There's still a lot we don't know. So the requirement that we're expecting, first of all, is that persons would be tested. Doesn't mean that if somebody tests negative today, that they can't develop the virus afterwards? The answer is no. But it certainly reduces the risk significantly if a person tests negative. The next thing then is the protocols that are being put in place. We've seen that IATA has shown really very good protocols for the airport. And a big part of that is the sanitization. Mm-hmm. You know, we talk about our individual hand washing, etc. So we're talking about an additional crew that's going around and constantly wiping down counters, where you're going to be going through for security checks, washrooms, all the public facilities there. Instead of maybe doing it once a day, this is going to be done multiple times a day. And certainly hand sanitizers around the place, persons wearing face masks. When you get on the plane, the airline is now saying, they're talking about in the initial stage of maybe keeping the middle seat open, unless it's a family traveling together, that you will have to bring your food on the plane. Mm-hmm. So there's not going to be where the flight attendant is going to be interacting with people on a regular basis. So the flight attendant's interaction with the customer is going to be really extremely limited, and certainly is only going to be there for emergency services. When the plane, before the plane leaves, it's going to be desanitized. When it arrives in Saint Lucia, now we have to work with the workers to make sure that they feel comfortable going on the plane, and now also sanitizing the plane again before it picks up new passengers. When they get off in Saint Lucia, the plexiglass is around for the immigration officers. Very limited interaction with the customs officers. Again, these are not high-risk individuals that are coming back. When they get onto the bus, that the bus is now sanitized, and that we're even talking about putting a plexiglass, if I'm not mistaken, around the driver, so that the driver is not going to be in contact with the persons coming on. When they get to the hotel, that there will be proper sanitization. The staff will also be trained. Gloves for the workers, masks for the workers, an upgraded nurses' quarters. So the idea of just having one nurse that literally stays in the room only when somebody comes to them, that's gone. That we're expecting at the airport that persons' temperatures will be taken. That when they're at the hotel on a daily basis, that their temperatures will be taken. The local staff that are going to work have to be tested and their temperatures taken every day. And that they will shower on the property, that their uniforms will remain on property, including their shoes, so that the possibility of bringing anything back to their home is minimized. So I want to say that the testing, as well as all of these new protocols, reduces the risk significantly. Now, you notice my language. Reduces, does not eliminate. And so in the pilot phase, what we're attempting to do is to see how much risk there is. So we believe that because we have the new hospital, Victoria, and some of these protocols that we're putting in place, that the risk should be minimal. The question is, what's our level of tolerance?
Yeah.
If we get 1,000 tourists coming a week and one person gets a corona, are we willing to live with that? And because of our understanding of testing and contact tracing and social distancing, we automatically now know who that person has been in contact with, and it makes the job much easier. To the CMO's point, if in fact these tourists were coming down and we didn't have these protocols in place, and they were renting cars and going to restaurants and going out, if in fact one of them became affected, we wouldn't even know where they became affected. Did they become affected down with it? Did they get affected from the community? And how many people were they in contact with? And all of a sudden we would have hundreds of persons now that we would have to put back into stage. So the tourism industry is a significantly important industry to our economy, one that cannot be replaced today, cannot be replaced in the next year, and the likelihood is we cannot replace it substantially in the next 5 years. So do we believe that the industry is going to come back? We do believe so. All indications of other crises that we have, that it has. Is St. Lucia's dependence on tourism too great?
That was one of the questions.
Yeah, I mean, this is a question that keeps coming up
Yes.
and up. I mean, it's affected the whole world. The price of oil has dropped in large part because tourism on a global basis has collapsed. Tourism is on a global basis collapsed because of international borders. It's the industry that causes persons to cross borders the most. But as a consequence of that demand going down globally, every other industry in the world has been impacted. And the same thing applies in St. Lucia. Tourism does not in any way prevent any other industry from growing. I don't know of a piece of land that we have where a hotel is that it's replaced banana production or fresh produce. There is no industry that can create the kind of domestic demand for our fresh produce and for our services. So it's not a matter of one or the other. So this constant argument in terms of whether we have too much emphasis on tourism and not an emphasis on agriculture, I'd like to think that we have an emphasis on both of them, right? There's been never anybody who said, let's not have agriculture. What we've recognized is by growing tourism that we create a stronger demand for our local produce, as well as exposing tourists to some of our products. Who would know Chairman of Chairman's Rum if you didn't have tourists coming here? The impact of 34 million Americans going to Mexico and the impact it has on Corona Bear and its worldwide recognition is because of the awareness of tourism. So that's an argument that really goes nowhere, and that's really not helping us resolve what the issue is. To get tourism and the global economy going again, of which tourism is part of the global economy, we need to resolve COVID. And so we're here today to say St. Lucia, for the most part, has resolved COVID. and it's allowing us to get our domestic economy going. And we've recognized that we need to maybe we have prepared ourselves to reopen, but it's not a decision that we can make by ourselves. I had phone calls this week with the president of Estonia, who has been an inspiration to me in terms of what Estonia has achieved from an e-government platform. And she reached out again to reiterate her support in whatever they can do to help us in continuing down that path. I had a very good conversation with the Prime Minister of Canada, Mr. Justin Trudeau, where we talked about what they have been going through, what we've been going through, and that the need for his voice for the SIDS, because the SIDS are again being marginalized one more time. We explained that after World War II, and because everybody did not want a World War III, that the UN, so the League of Nations became the UN. We had now the World Bank and the IMF. So globally, everybody recognized to prevent a war from taking place, we must have diplomacy and we must have equity from an economic perspective. And that was really what the goal and the mandate of the IMF and the World Bank were. When that was designed, small states didn't exist. Small states only really came into existence when England decided to decolonize all of these countries. So late 60s until the late 70s, and in some cases even early 80s, is when they came on the scene. And very quickly, first crisis was the Gulf War. Next crisis was 9/11. Next crisis was the financial crisis. Then we now had the climate change. And all of them showed that the World Bank and the IMF were not designed to deal with these small states. They were trying to categorize us by using one singular measurement, which is per capita GDP. And once your per capita GDP made it past a certain level, you did not have access to development funds. So in essence, all of our development needs had to be on a commercial basis. And we're just too small. So we kept on saying, so when big countries like China and Europe and America are emitting carbon emissions, it doesn't stay in their hemisphere. It goes into the global hemisphere. And that global hemisphere then impacts us. So here is it that our economies are confined. You're restricting how much development aids monies we can get, but you're causing a situation on a global basis that was having a disproportional impact on us because of our proximity to the equator. The economic crisis. The G7 became the G20. All the things that they used to solve their problem, which was liquidity, none of that was made available to us.
Not to cut you short, PM, but do you see COVID-19 now speeding up what we've been working on for so long to have the SIDS classified differently so we can access those funds?
Well, we're certainly not allowing this crisis to go unnoticed, and reiterating once more the impracticality of the global economic architecture as it pertains to small island developing states. So in simpler terms, the laws that define how these international institutions work with the small island developing states has to change. And so I think that we're all of one singular voice, but I think that the idea of constantly going, and I'm sorry to put it this way, because it's not begging, but it comes across as begging, where we go on an individual basis and saying, we're a small island developing state, we're vulnerable, and then you owe it to me. The world doesn't work like that. The world doesn't have, economics has no conscience. That's what I keep saying to everybody. You know, colonialization had a conscience in that ultimately there was a person making the decision. Economics has no conscience. You know, when it was time for Pan American to go, it went. And we're seeing that play out today. I mean, before I came here this morning, Air Canada's letting go 50% of its staff. Saudi Arabia, a 50% cut in salaries across the board for government workers. Increase in the VAT rate from 5% to 15%, so that's a 300% increase in the VAT rate. So the equivalent here would be that the VAT rate would have gone to 40%. And they've cut the government budget by $30 billion US. That's Saudi Arabia. Now, Saudi Arabia is being impacted both by COVID as well as by oil, but oil is also being impacted by COVID. So there's no country in the world that has become immune to what is going on. And sometimes I think that St. Lucians believe that we're living in this little bubble and we can watch it on TV, but it's not supposed to impact us. This is why we use the term all in. To solve this problem, if government is to act selfishly and to deal with it just as to what our problem is, I'm not so sure that that would be the best way forward. And that's why we're saying that if we share in the pain temporarily, and to make sure that every single solution has a fair chance of surviving. So 18,000 people applying to NIC, that is possibly 18,000 households, right? Of where the person could have been and more than likely would have been the primary bread earner in those parts. So we have a long ways to go from an economic perspective. And I bring up social stabilization because social stabilization runs parallel with the economic recovery. Social stabilization is the filter to make sure that whatever recovery path we're on, that it's fair and that no one sets of persons are being asked to contribute more than the others. And this is why it's so important that the civil servants come on board. I mean, it was interesting to note yesterday that Prime Minister Motley now is talking about a compulsory savings, which is in essence the bond proposal that we're having. Every single country in the CARICOM, every one of them, is going through what St. Lucia is going through. I chose very early to come out. April 2nd was our first meeting with the unions. Prior to that, I've spoken about rationing very early in the day, saying that when you look at the impact on the economy and the amount of money that's going to be in circulation, it's going to require persons to ration. During a war, we've used the word war, people ration. So I've chosen to come out, my government, very early to put these things on the table, not in fear of being criticized as to whether people want to consider we've mismanaged the economy or not, but to put persons on notice that there are changes that we're going to have to make. My government is not going to just impose those changes by themselves. But I have to say to you that it's getting to the point now that this is the last month that we can go through without having a definitive solution for the remaining amount of the year. I'm sufficiently convinced that even with this pilot phase that we're proposing to do with tourism, that we're not going to see a meaningful return of tourism at the earliest September, but certainly when you hear airlines talking about starting services next year, in the same Air Canada article, which is online so persons can go and read it, they're saying that we're going to be a much smaller airline than we were pre-COVID. The IATA are saying that it's going to take until 2025 until the number of passengers traveling internationally pre-COVID is going to take until 2025 to get to that number again.
Yeah. PM, I want to get to some of the questions because they're actually based on some of the things you're saying. Dean Nestor wanted to know, since you spoke extensively in your budget presentation about the economic impact of COVID, has the phased reopening of the economy so far alleviated any of the damage that had been done? And do you anticipate with the reopening it igniting the economy a little bit for you to be able to collect more?
This is work in progress. So I don't know the answer to that question. I know that the month of month of April, we generated $50 million in revenue. Last year, May, we did about $110 million in revenue, just to put it in perspective. Yeah. To our budget, we had budgeted to get 79 million. So we were still $30 million short. What's the month of May going to bring? You know, so far the month of May has been on pace or slightly ahead of where we were in April. But we're still thinking that that number is going to be somewhere between 50 and 60 million. the importance of getting the capital projects started, getting the road constructions going. The big one really is your call centers, because that's a bit problematic, because it's still going to require a certain amount of social distancing to ensure that we don't have what happened in Jamaica happen to us. So it's a thing that we're keeping our eyes very close on. We're thinking that without tourism and getting all of these projects going, that the revenue will be somewhere between $60 and $65 million, right? Which is still going to be short of the 79 million. To get to the 79 million is going to require tourism to reopen. But I don't want to say definitively, but that's what it seems to be. So we were waiting. Remember, we kept on saying we're going to wait. We have a couple of phases. The first phase was to deal with the cash shortage. Once we have a clearer sense as to how much revenue we're going to generate, then we can start to adjust. And how long do we think it's going to take before tourism is going to get back to any kind of level of normalcy? So until we can get back to the $100 million number, I'm sufficiently satisfied that we need to finish the year's budget, estimating that the revenue is going to be, on average, 65 million. So it means that some months are going to be below, and hopefully at the end months that it's going to be higher, but the average will be 65 million. So if it's going to be 65 million, that is close to $14 million short of what the projection was. And then we have another one, which is the bonds and treasury bills, which we know right now, if it stays on pace, there's another $15 million a month of cash. So that's the $30 million that I've spoken with. But at minimum, between June and March of next year, the government has to cut $200 million in expenses. That doesn't mean that it has to come from salaries, but it just means that collectively we have, and naturally because salaries are 50% of your expenses, if you don't make some cut there, then it means that you have to cut the $200 million on the other stuff. I can't cut debt. So that's the problem that we have in the short run. But we, before the end of this month, must find a solution. And I'm hoping that in light of what's happened in Barbados, what's happened in other countries in the Caribbean, and that some of the solutions that persons are seeing are coming out, which are very similar to what our solutions are, that people will start understanding this is not politics. This is not business as usual, and that we need persons to sit at the table as mature, mutual respect partners to solve the problem. I love my police officers. Adore them. Can't survive without them. First thing that we did was the police ball when my administration came in. I think that we've done, and hopefully it's recognized, done more to help my police officers than any other administration. My nurses and my health staff, full support. I don't think that there's a senior member that's come to one of our budget meetings that it's not lasted 6-7 hours in terms of talking about, first of all, what's the finish line, how we're going to resolve the problem, how we're going to help you provide the services you want, and this is where the healthcare insurance, what we're doing at OKEU, the money we're spending at St. Jude's, the money we're spending on fixing up primary healthcare services. Who can argue that this administration has not put health on a high priority? And even before COVID, we said that this budget was going to be the year of health.
Yeah.
So when I hear persons saying, well, you're not respecting me because you want me to take a haircut or to take some kind of reduction, I don't get it. Where is that coming from? This is about doing something for our country. This is something in which we're all feeling the pain. And everybody must come to the table. And I'm really sincerely saying to the union leaders, stop it. It is not your job to tell the government how to run government. You are a component of government. And so saying that you don't like this project or you don't like that project, that is for the electorate of this country to determine when the election comes. That's when that judgment day is going to come. Right now, we have a crisis on our hands of a shortfall of $30 million that cannot continue. And if we don't find the solution, it's going to be very difficult for everyone.
Thank you, Prime Minister. We do want to get to a few more questions before we wrap up. There are some tourism-related questions. Again, can Saint Lucia sell itself as a safe destination, given the relatively low numbers we have had? And would this give us an edge over other tourism destinations? Is it something we're looking at? And Jade had a follow-up question in terms of what benefit would it be to the economy if the visitors can't really visit some of the natural sites and go on some of the tours?
So very quickly, yes, I think that the success that we've had so far will augur well for Saint Lucia in its marketing. I want to really congratulate the Tourism Authority. They've had a program out called 7 Minutes in Saint Lucia. That's been a social media sensation and huge success. We do have some ads that we've been working on to get into the marketplace. So I think that Saint Lucia's success will augur well for us in our brand moving forward. The pilot phase is about getting people's confidence to travel. And the confidence is on both sides. It's both getting the tourist to believe they can come to Saint Lucia and be safe and to return home safely. Secondly, we must get it, and equally important, that Saint Lucians who are going to work at the hotels feel safe. And so the pilot phase is to limit the exposure initially. And it's the first step in being able to reopen our doors. So it's no different than we've been reopening and kept curfews in place and kept the zones in place and kept protocols in place. And we've done it slowly so that persons start feeling, okay, I've seen that this has been going and we've not seen a major outbreak in the country. This is no different. So we expect the pilot phase to last anywhere between 1 month to 2 months. And once now, we've seen over 4,000, 5,000 people come to Saint Lucia on a weekly, over the period, and that we don't have any outbreaks, that person's confidence will now grow both from a consumer perspective as well as from a domestic perspective until we can return fully to the open business. But the goal is certainly to have tourism in our communities, but until we know that the person's coming down, that the chance that they have COVID is minuscule, we cannot allow them into the communities. But we expect that phase to last, as I said, to somewhere between 1 month to 2 months.
Okay. CMO, this one might be for you, from Sheffield Gillard from Loop St. Lucia News. International travelers would need evidence of a negative COVID-19 test prior to traveling to St. Lucia. According to U.S. health officials, false negative COVID results can and do occur. Will St. Lucia authorities be administering an additional test at the port?
At this point in our collaborations with the Ministry of Tourism, it is not practical to do testing at the ports. In St. Lucia, we've been using the real-time PCR testing, which is the gold standard for COVID-19 with 99.9% accuracy. Presently, a lot of in the developed world, there's a lot of research going on the development of an effective, accurate rapid test. We are really hoping that by June, there is a rapid test which is accurate enough that we can have it available at more sites. But for now, locally, we use the PCR testing.
Okay, there's a follow-up just with the cost of COVID tests and its availability remains a challenge for the United States and the British, two of our biggest source markets. With both countries also reopening despite rising cases, will St. Lucia take special precautions against visitors coming from these two most affected regions?
So I just want to really continue a little bit on what the CMO indicated. Whatever protocols we're going to put in place, we're trying to marry a multitude of things. So can a plane continue to operate with only 2/3 occupancy? Can a hotel operate with a 50% occupancy? They can't. And so the practicality, imagine, of 150 persons arriving on a plane or 90 persons arriving on a plane, and you're going to say, you need to wait here. We're going to all do the COVID test on you. that takes 48 hours to get a result. And if one person on that plane has test positive, then whoever was sitting next to that person, it creates a problem. So that's why the testing has to be done prior to the person's coming in. And the reason why we're putting them into the isolation, I think that the CMO was trying to be politically correct, but we're putting them into isolation. They're getting an isolation vacation. That's really what they're getting. So the purpose of doing that is to restrict their interaction. So if they do have symptoms and we put them into an isolation room and they test positive, that it doesn't mean the whole program has to close down. But we honestly believe, and that's where you have to test out the theory, that if a person is being tested within hours of before they're coming down to Saint Lucia, the likelihood of them being positive is reduced significantly. And as I said, then all the other protocols that we're putting in place limits the exposure to anybody who may make it through that screening process with COVID. But it certainly reduces the risk substantially. And that's why we're calling it a pilot phase. If in fact, in the first week, as an example, 10 cases appear, then we would stop the program, because it means that the filtering that we're doing is not working. We're not going to accept a 1% exposure. We need to have 1/10 of 1% of exposure. And so that's why I'm saying to you the combination of the things that are available. And I've also said today, and again, that's why I want to re-emphasize it, that Saint Lucia is going to be ready as June 4th, but it's questionable whether in fact all of our source markets will be ready, because they still have travel advisories on. Until some form of an accepted test level is available, it's impossible. But I genuinely believe that with the United States' particular emphasis to reopen and the fact that people are not traveling, I personally believe that within the next couple of weeks that the US government and the US authorities will recognize that rapid testing, once there's one that we believe in, will be made available at the airports, and more than likely will become a prerequisite for persons even traveling domestically, because it's about gaining persons' confidence. So it'd be after 9/11, if they did not put in the security protocols, would people have gone back on the planes? You know, today, I think that if you went to the airport and nobody checked your bag, you didn't do proper screening, etc., people would be nervous. So these are the things that we have to solve, and that was what we're trying to make happen as quickly as possible.
As we were speaking, PM, someone just sent me an article from Iceland marketing themselves as COVID-free.
Yes.
It's very, very
But
interesting.
also what Iceland did is Iceland has said, I think June 15th is when they're opening up their borders. And also what they're doing is that requiring persons to be tested when they arrive. But I just don't think from a practical perspective that that's going to work. So if I arrive in Iceland, I get tested there, I test positive, I'm automatically put into things. So it defeats the purpose. Equally, if I come into Saint Lucia and if I'm going to return to the UK or return to Canada and I have to go into quarantine, that's also not going to work. So in our negotiations with Prime Minister Trudeau and also with his team, with the Prime Minister in the UK, and certainly with authorities in the United States of America, the protocols must be in sync with each other, because it has to work both ways. And even in our dialogues with the cruise ships, and yes, we have already begun having dialogues with the cruise industry, because they depend on the tours when they come here, we have to be satisfied the persons getting off the ship are not going to impact us. So it means when people get on the ship, they have to be tested. They have to prove us that they're doing temperature testing on a daily basis. But similarly, they have to know that when the guest comes into Saint Lucia, that they're also not being exposed, so that when they go back on the ship, that they're okay. So I want everyone to understand that this is not one set of persons. We can't create a set of rules that only protects Saint Lucia. There's a multifaceted approach to what we're attempting to do here.
Thank you very much. And we have a final question I've been asked to squeeze in, just on support for small businesses, PM. That one keeps coming up. What are we doing in that regard?
So I'm very happy that the funds from the EU to go into the Development Bank has been finally approved and now is in the Development Bank. We have been working with the World Bank and CDB as well to see if we can get some of our loans repurposed to put them into the development bank and possibly even into the commercial banks. We've spoken about the idea of saying, okay, can the commercial banks create a special program for SMMEs, and that the government will now allow the profits from those loans to be tax-free. So what it does, it gives the banks a bit more leeway in terms of taking risk. We clearly recognize as a government that to genuinely get back to full employment in this country, and maybe even better than we were pre-COVID, small enterprises are critical. And while we're helping persons right now with some income support, this is subsistence money. I've repeated, this is not the economic stimulus. The social stabilization has nothing to do with economic stimulus. This is simply from a humanitarian perspective, allowing households to at least put food on the table for the next couple of weeks until we see a recovery taking place. But I'm a huge believer in small businesses. And we recognize that government, unlike other governments in the world, I don't have millions of dollars laying around that we can just inject into the small businesses, but we have to work through all our different partners. But that is a critical component. I really want to thank Minister Bradley Felix and his PS, Sophia, for being relentless in pursuit of that group. And that includes the entertainment business, the arts and crafts business, and that's why we've now moved more expeditiously to get the second and third phase of the Castries market going. We have to continue to invest in the infrastructure of this country to reduce our cost of operations and to make us more competitive. We have to believe that the global economy is going to come back. And what I want to do is make sure that once that door opens, that Saint Lucia has done everything it can to advance. Phase one of what we're attempting to achieve is why we're here today. Huge milestone. We're ahead of the world in terms of now being COVID-free for the most part, and that it allows us to more aggressively move to do these things. Let's not waste this opportunity, right? Let's not think and start second-guessing ourselves as to what we should do and what we should not do. That's the role of a government in office. They're the ones who get to make those decisions. And every 5 years, the general public get to determine whether they're happy with the decisions that the government is making.
I think yesterday, PM, as we were ending, you really gave a heartfelt plea and thanks to a lot of people who have come forward in this COVID-19 situation to assist Saint Lucia. You basically said, well done, Saint Lucia. I just want to have you to just say some final words as we wrap up in terms of the way forward for our country, very briefly.
Very briefly, we have shown ourselves what we can do and what we can achieve. This is a global crisis, and Saint Lucia has emerged as a global leader in this issue. You have. We've done what 90% of the countries in the world could not do. And I think that we need to start thinking of ourselves in a much more positive light. And when we talk about it's our time, let's do it, that's what we're talking about. We can do this. We've shown that we can do this. And let's not stop halfway. Let's take advantage of this crisis and move Saint Lucia up the ladder. I've indicated repeatedly that the output of Saint Lucia on a country which is measured by the GDP is way too low. If we had the per capita GDP of Aruba, we would be at $4.5 billion. If we had the per capita GDP of Barbados, we would be at $3.5 billion. If we had the output per square mile of Aruba, we would be $18 billion. We're underperforming. And part of that underperformance is because we've not developed ourselves sufficiently into a country of excellence. Let's not strive for mediocrity. Let us strive to be the best. And I think that solutions have shown, and I so much respect all of you for what we've been able to achieve collectively together. And we should all hold our heads high and recognize at this juncture, we are way ahead of the rest of the world. Let's make sure that over the next couple of months that we can put ourselves in a position in which we see an economic recovery that is ahead of the world. And let's take advantage of this situation. We're small enough, we're bright enough, we're brilliant enough. And certainly, unlike what other people have been saying, we are disciplined enough to do this. And I just want to say thank you to all of you. Many people said it could not be done. We've now shown them that we can do it. Our CMO and her staff, the Ministry of Health, our police officers, the work that they have done over the last couple of weeks in reducing crime in this country is remarkable. And they've stayed the course. My ambulance drivers, my firefighters, we've had 2 major fires in Saint Lucia, and despite not having all the requisite equipment, what they did in Marcia the other day is a miracle. Anybody who goes down there and sees this house that was on fire in the middle of that area, and they were able to contain the fire in no time just to that household. We have brilliant and great people in this country, and it's time that we start raising their profile, and we start now lifting each other up instead of taking each other down. But thank you for all that you've done.
Thank you, Prime Minister Honorable Alan Chastanet. Thank you very much to CMO Dr. Sharon Belmar-George. Thank you to Mr. Ragnanan, who, as I said, will be giving a further update later today. Stay tuned to the Information Command Center just to remind everyone that the country is reopening as of Monday. There will be specific protocols and guidelines that will be available on COVID-19response.lc and of course on the Ministry of Health pages as well. I'm sure many of us look forward to the lifting of the zones and seeing all our friends in 759 and crossing the borders. We also are looking forward to the pushback of the curfew to 9 p.m. to 5 a.m. as of Monday, May 18th. Thank you for joining us. Please stay tuned for the Saturday wrap-up with Jesse, Carlton, Tony, and Lisa. Thank you.